Type 2 diabetes is when the body can still produce insulin, but it does not produce enough insulin or because the cells cannot use insulin. Type 2 diabetics do not need insulin injections like type 1, but must resort to hypoglycemic agents. However, on the market today, there are countless drugs and patients often do not know all the side effects of the drug they are using. To better understand the advantages and disadvantages of each type 2 diabetes drug group. Group 1. The drugs increases insulin sensitivity. This group is divided into 4 subgroups including Metformin biguanide drug. Metformin is a treatment for diabetes in biguanide group which is being used very much today. That is why it is very important to understand and use this medicine correctly. Metformin is an oral medication that controls blood sugar and does not cause weight gain. One-off drugs which is often prescribed for overweight and obese subjects, but its effectiveness is comparable to that of non-obese people. The drug works by reducing blood sugar by inhibiting glucose regeneration. Mechanically, metformin reduces the synthesis of glucose in the liver, and increases insulin sensitivity to fat and muscle cells. The metformin drug is indicated in the treatment of non-insulin-dependent diabetes, type 2 diabetes, used as monotherapy when it is impossible to treat hyperglycemia with diet alone. In addition, metformin can be used with sulfonylurea drugs, and in combination with a healthy diet. In fact, administration of metformin or sulfonylurea alone will not adequately control blood glucose. Advantages: inexpensive, does not cause hypoglycemia if used alone, does not change body weight, reduces the absorption of bad cholesterol and triglycerides, prevents cardiovascular risks. Disadvantages: not suitable for patients with renal impairment, especially those with GFR less than 30 ml per minute. The patient may experience some digestive symptoms such as anorexia, indigestion, diarrhea. Thiazolidine-dione (TZD) drug. Thiazolidine-dione, or glitazone, is an effective group of drugs to reduce blood glucose in patients with type 2 diabetes. TDZ includes 2 common active ingredients, rosiglitazone and pioglitazone. Both play a role in increasing the body's sensitivity to insulin, helping to control blood sugar levels. Advantages: similar to metformin and especially can be combined with other drugs to increase effectiveness. Disadvantages: causes swelling, edema, and sudden weight gain, common in women, impaired vision and increased risk of bladder cancer, heart failure. GLP-1 receptor agonists drug. In addition to increasing insulin sensitivity, GLP-1 receptor agonists also work to increase insulin secretion, limit liver glucose neogenesis, and reduce appetite. The active ingredient commonly used in the group is exenatide. Advantages: can be used in obese patients with postprandial hyperglycemia, low risk of hypoglycemia. GLP-1 is indicated for use with metformin when this drug is no longer effective if used alone. Disadvantages: easy to cause abdominal pain, nausea when used, contraindicated for patients with kidney failure or a history of thyroid tumor or thyroid cancer. Acute pancreatitis should also be avoided, although more research is needed to prove it. In addition, the drug must be used by injection. Dipeptidyl peptidase 4 (DDP4) diabetes drug. DPP-4 inhibitors group, also known as gliptin, including active ingredients such as sitagliptin, vildagliptin, saxagliptin. This is considered a new class of drugs in the treatment of type 2 diabetes. The mechanism of action of the drugs increases insulin secretion and decreases glucagon formation in the liver. Advantages: less side effects, well tolerated, does not cause hypoglycemia when used alone, can be used for people with chronic kidney disease, the elderly. Disadvantages: not as highly effective as GLP-1 receptor agonists, more expensive than metformin, which can cause allergies, itching, redness. Group 2. The drugs causes increased insulin secretion. These drugs stimulate the pancreas to secrete more insulin, which in turn helps to regulate blood sugar. Currently, there are 2 groups of insulin secretion stimulants: sulfonylureas glimepiride, glibenclamide, gliclazide, glipizide, and glinides, ripaglinide, nataglinide. Sulfonylureas drug. These diabetes drugs play a role in stimulating the pancreas to secrete insulin. This hormone prevents the release of glucose from the liver and increases the synthesis of glycogen, the main storage form of glucose in the body. Advantages: low cost. Most drugs in the group have been thoroughly researched. When used, can reduce the risk of complications of small blood vessels and cardiovascular diseases. Disadvantages: continuous use of patients is likely to have hypoglycemia and mild weight gain. Group 3. The drugs work to slow the absorption of fats and glucose from the intestine. Typically in this group of diabetes drugs are alpha glucosidase inhibitors, acarbose, and lipase enzyme inhibitors, orlistat. Alpha glucosidase inhibitors drug. The mechanism of action of this group of diabetes drugs inhibits the breakdown of carbohydrates into glucose in the small intestine, thereby preventing glucose from entering the bloodstream, reducing the sudden hyperglycemia after eating. A special feature of the enzyme alpha glucosidase inhibitors is that it is not insulin-related. Advantages: there is no risk of hypoglycemia when used. Disadvantages: bloating, constipation due to slow digestion, in addition high cost. Lipase inhibitors drug. Lipase is an enzyme that breaks down the structure and helps fat to absorb through the intestines. Undigested fat will be eliminated from the body. This class of drugs is often used to aid weight loss in the treatment of type 2 diabetes. However, you should consult your doctor before taking it. The disadvantage of this group is that it can limit absorption of oil-soluble vitamins or cause diarrhea. Group 4. Insulin. In some cases, people with type 2 diabetes need insulin therapy because diet, exercise, and oral diabetes medications do not reach their target blood glucose levels. Insulin injection is one of the major complications of diabetes. When not controlling well, blood sugar levels leads to excessive insulin use. Advantages: for quick effect. Disadvantages: can cause excessive hypoglycemia if multiple types of insulin are used for treatment. High cost. Need to know injection technique if you want to do it yourself. How is the diabetes treatment most effective? A well-balanced and rational diet has a significant impact on the effectiveness of disease treatment. Because any food you consume has the ability to change the blood glucose index. To limit this effect, you should pay more attention to calculating your carbohydrate intake, and you should split meals to avoid the risk of sudden hypoglycemia. With snacks, you can choose to use diabetes milk. Thanks to scientific advances, a few types on the market today not only provide essential nutrients but also help patients to control the levels of insulin secreted. There are even types that add myo-inositol, which is one of the 9 isomers of inositol that play a role in increasing insulin sensitivity. This is essential for people with type 2 diabetes. Another way your body uses insulin effectively is to actively exercise, control your weight, and keep yourself from stress and pressure. With exercise, patients need to consult their doctor to choose safe and suitable exercises for their medical conditions. The good exercise of these measures can sometimes help the patient reduce the frequency of taking medications and keep blood sugar levels stable for a long time. Above are basic information about diabetes drug groups with the advantages and disadvantages of each. Hopefully, through this article, you can equip yourself with useful knowledge about using medicines to ensure good health.